morning, Miss Mosier. My name's Ashley. I'm going to be your nurse performing your physical assessment today. How are you today?
I'm good, thank you.
Good. Before I get started, I'm just going to clean my hands. Have you had any issues or concerns lately?
No, not really.
No? Okay. Can you tell me your name?
I'm Abigail Mosier,
Your date of birth?
12/22/89,
What month is it?
December
What year is it?
2018.
Just a couple questions we ask all of our patients. Have you had any feelings of anxiety lately?
No.
Hopelessness?
No.
Loneliness?
No.
Any sort of feelings of depression at all? No? Okay. Have you lost interest in activities that you usually enjoy?
No.
Good. Okay, so I'm going to go ahead and get started. The first thing I'm going to do is get your height and your weight, okay? So if you want to step over here to the scale for me. Go ahead and step on. Good. At this time, if I had a ruler, I would get her height, but I don't. Alright, the next thing I'm going to go ahead and do is get your vital signs, okay? So I'm going to get your blood pressure, your temperature, your respirations, and your pulse, okay?
Alright.
I'm going to start with your temperature here. Under your tongue. Good. 98.2. I'm going to go ahead and get your blood pressure. Sleeve up. Yes. Good. 132/84. The next thing I'm going to do is I'm going to go ahead and get your pulse and your respirations, okay?
Okay.
Good. Your pulse was 80 and your respirations were 18. Good. Okay, so as I'm working through the rest of your assessment, I'm going to integrate your skin assessment in with the rest of your body system. Have you had any skin issues lately?
I've had some different redness and dry spots. It happens on my face and on my hands.
Okay, have you taken anything for that?
I've tried some steroid cream and it seems to help.
Okay, are you still using the steroid cream?
Sometimes.
Okay, other than that, no skin issues?
Nope.
Okay, I'm going to go ahead and check your skin marker, okay? This is just to measure your hydration status. Good. Have you noticed any swelling lately?
No.
No? Okay, have you had any recent hair loss or changes in your hair?
Mm-mm.
No, I'm just going to go ahead and feel your hair. Good. Have you noticed any nail issues lately? Any strengthening changes or anything?
No.
Good. Okay, I'm just going to take a peek. I'm checking your capillary refill, and all that is checking is how quickly it takes the blood flow back to your finger after I've occluded it. Have you had any headaches lately?
No.
Any dizziness?
Mm-mm.
Lightheadedness?
No.
No. Have you had any head injuries?
No.
Any concussions?
No.
Good. Okay, I'm just gonna go ahead and palpate your skull, okay? Does that hurt at all when I press here?
No.
No? Okay, can you open your jaw for me? And close it? Good. Have you noticed any swollen lymph nodes lately?
No.
No pain in your neck?
Mm-mm.
I'll go ahead and feel your lymph nodes here. No pain when I press anywhere?
No.
Okay, I'm just going to feel for a carotid. I'll go ahead and feel for this one, okay? Good. The next thing that I'm going to do is check for your thyroid. So what I'm going to have you do is I have a glass of water here for you. I'm actually going to come behind you, and I'm going to have you turn your head to the left first, take a sip of water, and as you're taking that sip, I should feel your thyroid rise. Okay? Okay, go ahead. Good. Look to the right now and take a sip. Good. Take that from you. All right. Okay. Trachea is midline. Okay, can you move your head up and down for me? Good. Side to side. Good. And ear to shoulder. Good. The next thing I'm going to check is your eyes. Have you had any redness or irritation lately?
No.
Any discharge?
No.
No? Any watering?
Mm.
Okay. Do you wear glasses or contacts?
I wear glasses to drive.
Okay, just to drive?
Yep.
Okay. Have you had any changes in your vision at all?
No.
Any blurred vision?
No.
Any double vision?
No.
Okay. I'm going to go ahead and take a peek. Look straight at me, okay? Got it. Okay, the next thing I'm going to do is I'm going to have you look at my finger and follow it with just your eyes, okay?
Mm-hmm.
Good. And go ahead and follow it into your nose. Good.
Okay.
Can you go ahead and cover your left eye with your hand for me? Okay. Can you tell me how many fingers I'm holding up?
1, 2, 1,
Good. Go ahead and cover your right eye.
1, 2, 1.
Very good. Okay, so now if I had a Snellen eye chart or a near vision chart, I would go ahead and check that, but I don't have one right now. And if I had an ophthalmoscope, I would go ahead and look at the internal structures of our eyes, such as the retina and the cornea. The next thing that I'm going to go ahead and do is check your ears, okay? Have you had any ear problems lately?
No.
Any ear infections?
Mm-hmm.
Any drainage from your ears?
No.
Okay, good. I'm going to go ahead and feel them. The next thing that I'm going to do is I'm going to do the whisper test. So I'm going to stand behind you and I'm going to have you occlude one ear and I'm going to whisper 3 words into the other ear. And I want you to repeat them back to me, okay? Go ahead and include your right ear.
Apples are great.
Very good. Go ahead and include your left ear.
Pony light blue.
Very good. At this time, if I had a tuning fork, I would go ahead and perform the Rhine and Weber test. Also at this time, if I had an otoscope, I would go ahead and look at the internal structures of her ear. Okay. So the next thing that I'm going to do is I'm going to go ahead and look at your nose. Have you had any colds lately?
No.
Any sinus issues?
Mm-mm.
Any discharge from your nose?
I've been waking up with a bit of a stuffy nose, but nothing.
Okay, does it go away throughout the day?
Yeah.
Yes? Okay. Have you had any changes in your smelling lately?
No.
No? Okay. Okay. Then go ahead and feel. Any pain when I press anywhere?
No.
Any there?
Nope.
Okay, good. If I had an otoscope, I would go ahead and look at the internal structures of her nose. I'm just going to go ahead and use my pen light and look up there, and all I'm looking for is like deviated septums or nasal polyps. Good. Nothing. Very good. Have you had any issues with your mouth lately? Any lesions or sores? Any pain?
No.
No? Okay, go and open your mouth for me. Can you stick your tongue out for me? Move it up and down, side to side, and in a circle if you can. Okay, I'm going to go ahead and count your teeth now, okay? I'm going to start with the uppers. Good, and I'm going to do your bottom. Good. I'm going to go ahead and use this tongue blade to press under your tongue so I can visualize the back of your teeth. Open up for me. Good, and last thing, just say ah for me. Very good. The next thing that I'm going to do is I'm going to check your lungs, okay? Have you had any shortness of breath lately?
No.
Any recent chest colds?
No.
Any respiratory infections?
No.
No? Okay, so the first thing I'm going to do is I'm going to check your chest wall movement, okay? So I'm just going to place my hands here, and I need you to take a big, deep breath for me. Good. And can you go ahead and say 99?
99.
Again.
99.
Again.
99.
Again.
99.
Good. I'm going to go ahead and do the same thing on the back, okay? Just one big, deep breath for me first. Good. Go ahead and say 99.
99. 99. 99. 99.
Good. Good. So then I'm going to go ahead and listen to your lungs now. Big deep breaths for me. Good. I'm going to listen to the front, okay? The next thing that I'm going to do is I'm going to go ahead and check your oxygen level, okay? So I'm just going to go ahead and put this on your finger. Good, 98%. Okay, how many pillows do you sleep with at night?
One.
Just one? Okay, the only reason I ask that is because I'm trying to determine if you have any orthopnea or difficulty breathing when you're lying flat. So the next thing I'm going to do is I'm going to feel for your apical pulse and inspect your chest, okay? Good, just going to feel for your carotids again. Good, I'm going to take a listen to your carotids, okay? Go ahead and listen to your heart here. Good, your heartbeat is regular and it's about 80 beats per minute. I'm just looking for any jugular venous distension. If I had a ruler at this time, I would be able to measure the jugular venous pressure. Have you had any abdominal pain lately?
No.
Any nausea or vomiting?
No.
Okay, very good. Any recent weight loss or weight gain? No? Okay, I'm going to go ahead and inspect your abdomen. If you just want to lay back for me, that would be great. Do you eat a regular diet?
Yes.
Yes? Okay. Does anything upset your stomach?
Dairy.
Dairy does?
Mm-hmm.
Okay. Do you take any medications for that?
No.
No? Okay. I'm going to go ahead and take a listen here. Any pain when I press anywhere?
No.
Do you have regular bowel movements?
Yes.
How often?
Twice a day.
Twice a day? Okay. Okay. Do you have to take anything to help you move your bowels at all?
I take fiber sometimes.
Sometimes? How often?
Maybe a couple times a week.
A couple times a week? Okay. The next thing that I'm going to do is I'm going to go ahead and place my thumb here, and I want you to take a deep breath. Any pain?
No.
And one more time. Any pain?
Nope.
Good. Okay. Can you go ahead and we're going to flex the knee and the hip? Any pain?
No.
No? Okay, good. Okay, Miss Mosier, while you're still laying down, I'm just going to go ahead and check your hips, okay?
Sure.
Go ahead and flex your knee and your hip up. Good. Keep it there. Can you kick up for me? And can you move it from side to side? Good. You can put that leg down. Let's go ahead and do it with your left leg as well. Kick up. Move it from side to side for me. At your hip. There you go. Good. Okay, you can go ahead and put that down. I'm going to go ahead and have you sit up on the side of the bed now. Good. I'm going to go ahead and check your extremities for any color changes or any warmth, okay? And you haven't noticed any swelling lately?
No.
Just going to feel your pulses here, okay? Have you noticed any numbness or tingling at all?
No.
Good. I'm going to go ahead and look at your legs, okay? And check your pulses. Due to this video being uploaded to YouTube, I'm not going to check the femoral pulses. I'm going to go ahead and check your pedal pulses here. Okay, can you go ahead and flex your right foot up for me? Do you have any calf pain here? No? Good. And go ahead with your left. Good. All right. Just going to check your joints, okay? Open and close your mouth for me. Again. Can you move it side to side? And can you stick your bottom part out? Good. Just put your chin down to your chest, and I'm going to come behind you and look at your neck, okay? Just going to move your hair here. Good. Now can you look up for me? Good. And go ahead and move your chin to each shoulder. Good. And then ear to shoulder again for me. Very good. The next thing I'm going to do is have you hold your arms out, okay? And with your right arm, can you flex up for me? Good. And with your left? Very good. Okay. And then I'm going to have you hold your arm like this with your right and flip it up for me. Good. And again with your left. Very good. All right. So I want you to make a fist with your hands. Okay. I want you to try to pull back while I'm trying to resist you. Good. Okay. Can you hold your right hand out for me? Make a fist. Release it. Flex down for me and up. Good. And can you touch each finger to your thumb? Very good. And again with your left hand, make a fist. Release it. Flex down for me. Up. Each finger to your thumb. Very good. Can you go ahead and stick your arms out to the side for me? Again, try to push up while I'm resisting you. Good. Stick your hands together like this and go ahead and apply a little pressure. Is there any numbness or tingling?
No.
No? Okay, good. I'm going to go ahead and look at this arm. I'm just going to go ahead and palpate going up to your arm, okay? Is there any numbness or tingling?
No.
Okay. That's just to help us see if you have any sort of carpal tunnel syndrome. Any numbness or tingling? No. Good. Okay, Miss Mosher, the next thing I'm going to have you do is I'm going to have you turn your right foot out and back in. Good. And your left foot? Good. Can you flex the toes on your right foot? Good. And on your left. Very good. Okay. Now I want you to try to push out while I'm pushing in, okay? Very good. The next thing that I'm going to have you do is I'm going to go ahead and have you stand up, okay? And I'm going to go ahead and have you reach down towards your toes, and I'm going to go ahead and look at your spine, okay?
Okay.
Good. Okay, go ahead and lean back up. And can you go down each leg? Okay, very good. The next thing I'm going to have you do is I'm going to go ahead and have you walk forward on your toes, and then walk back on your heels. Okay? Good. And can you move side to side while keeping your feet in the same place? Very good. All right, while you're still standing, I'm going to go ahead and have you put your arms onto your side for me and close your eyes, okay? Keep them closed. Good. Good. You can go ahead and have a seat now, okay? Throughout my assessment, I have been able to assess the cranial nerves. Can you go ahead and touch your nose and then touch my finger? Again. Good. Can you squeeze my fingers? Good. Can you push down on my hands like gas pedals? Good. Just gonna check your Babinski reflex. Very good. At this time, if I had a reflex hammer, I would check all of her reflexes. So we're almost done here, just a couple more questions. Do you perform self-breast exams?
Yes.
How often do you perform them?
Usually monthly.
Okay, good. That's how often you should be performing them. Do you feel comfortable in how you're performing them, or should I go over that with you?
You can go over it again.
Okay, perfect. So while you're in the shower, you want to use the pads of your fingers, okay? And go in a circular motion, feeling for any lumps or hardness, okay? And you want to make sure that you check your armpit as well.
Okay.
And then in the mirror, you want to inspect for any sort of color changes or lumps or anything like that, okay?
Okay.
And then you want to lay down in bed. You want to place a pillow under either arm, starting with your right shoulder, right arm, and place your right arm above your head. And again, in a circular motion, use the pads of your fingers going into your armpit to feel for any lumps or sores or anything like that. Okay? And you also just want to make sure that you're doing the same for the left. And then you want to make sure that you're checking the nipples for any changes in color or discharge. Okay. Do you have any questions?
No.
Okay. Is there anything else I can do for you today?
No.
Okay, Miss Mosier. You have a great day.
Thank you.
Yeah.